are living with follicular lymphoma and are currently in the watch and wait stage, you may wonder what symptoms you and your doctor are looking for that mean it's time to start treatment. These signs and the timing may vary person to person, so it's important to have a conversation with your doctor. Listen as Dr. Jane Winter from the Robert H. Lurie Comprehensive Cancer Center at Northwestern University explains what symptoms she looks for to indicate treatment should start.
The trigger for treatment is a big enough mass that it's pushing on something important. For example, the ureter, which is the tube from the kidney to the bladder. And if we have a large mass that either wraps around that ureter or just pushes on it sufficiently to block drainage, it'll result in a decline in kidney function. And that may be the so a rising creatinine may be the signal that things are progressing and it's time for treatment. Sometimes it will, the follicular lymphoma involving the lining around the lung can lead to what we call a pleural effusion, fluid in that space. It's a potential space between the lung and the chest wall. And so accumulation of fluid there restricts your ability to take a deep breath, and that may be an indication for treatment, or just the overall total mass of disease is becoming such that it results in fatigue and is beginning to become impair the quality of life and what we call performance status. So those are triggers for treatment. Decline in blood counts is another. So follicular lymphoma very commonly involves the bone marrow. And as it progresses and replaces the normal blood cells, it will result in a decline in the red cell count, the hemoglobin that carries oxygen, and so results in tiredness or shortness of breath. Or a low white count, such that the numbers of infection-fighting cells is compromised. Most often it would be just some mild anemia that flags progression and bone marrow involvement. So all of those, so bulky disease that causes symptoms, disease that causes fluid accumulation around the lung or obstruction of something important organ. These are all the signs that it's time to think about treatment.
As you've just heard, there are a variety of symptoms that can signal that it's time to start treatment. That is why it's crucial that you go to all appointments, especially ones where tests and labs are done, so your doctor has the most up-to-date information or data on your lymphoma. Also, be honest about what symptoms you're experiencing and how you're feeling. No symptom is too small and is important to disclose, as that can show it's time to start treatment.